Welcome to the Candida Chronicles with our host, Michael Biamonte, certified clinical nutritionist. In this podcast, Michael will answer your questions and reveal the shocking truth that the cause of most chronic ailments is not what you've been told. The source is Candida, a yeast overgrowth which, when it becomes systemic, can cause all sorts of seemingly unrelated ailments such as chronic fatigue syndrome and even weight gain. For more information on how Michael can help you, please visit healthtruth.com. That's health-truth.com, or phone his office at 212-587-2330. And now, without further ado, Michael Biamonte.
Hello everyone, this is Michael Biamonte, clinical nutritionist. And in today's podcast, we're going to be discussing a rather important subject. This is something which is vital to know if you are a patient with candidiasis. However, it's very confusing and very misunderstood subject of the relationship between candida and viruses. Now, in actual fact, there is really no relationship between candida and viruses because they are distinct and very different species of microorganisms. However, from a patient standpoint, from a real life standpoint, candida and viruses have a relationship because, for the most part, both can be classified as opportunistic infections. Now, what I mean by an opportunistic infection is an infection which seeks the opportunity of the person having lowered immunity in order to attack the host, meaning you. When the person develops candidiasis, he becomes far more susceptible to viruses. The more typical viruses that the person is susceptible to from the viewpoint of the candida patient or the patient who is run down, exhausted, and whatnot would be viruses that are from the herpes classification, which include the HV6, herpes 1 and 2, and of course the hallmark virus, which is Epstein-Barr. The Epstein-Barr virus is the same virus which produces mononucleosis. As a matter of fact, mononucleosis is the initial acute stage of Epstein-Barr. So when someone has mono, what they actually have is Epstein-Barr virus in the acute stage, and usually it would be the very first time they've had the virus flare up. If they've had a minor flare up of the virus, that would be considered unusual. Typically, the first time the virus attacks you and goes into full replication is where we would call it mononucleosis. Now, in future times, if the virus is to reactivate, and if the virus is to cause a repeated infection, it would be thought of and called Epstein-Barr virus. The future replications of the Epstein-Barr virus are usually not as acute as the first time when the person had mono, but yet they are very similar to the mono activation. Very confusing to understand if you have a virus. Many people are told that they do have virus, and when you actually look at the person's blood work, you find out that they don't. You find out they have a past virus. So today, one of the things that I would like to do is go over the proper interpretation of a viral antibody test, because I find it's something which is very confusing to many doctors. Many doctors completely misinterpret these tests, which is interesting. You would ask yourself and wonder why and how that could be. And to be honest with you, I myself do not have an answer as to why that is. I can just simply tell you that it's something that I too have experienced, that when you're dealing with people who are supposedly experts and they're interpreting your test results, well, you would hope that they would have the proper interpretation of the test. With the interpretation of the test that I'm going to go over with you today, I actually consider a traditional interpretation, but this traditional interpretation happens to be quite correct, which is something that you don't often find. The key to interpreting a viral test, whether it's Epstein-Barr or whatever, but typically you would be looking at cytomegalovirus virus or Epstein-Barr virus, is to look at two antibodies. The first is IgG, and the second is IgM. The IgG antibody is typically the most common one that's tested for, which is kind of dumb, because if you don't have the IgM to compare it to, you're in trouble. Epstein-Barr essentially cycles through its lifetime. It has an initial cycle, which we refer to as mono. Then we have a first reactivation of the virus, where there are certain antibody patterns. We then have a convalescent phase, which is where it is now receding and going into a remission. Then we can have another reoccurrence cycle, and then we have chronic reactivation of the virus. These are some of the basic cycles through. Initial cycle, which is typically mono, or thought of as mono. First reactivation, which would be thought of as Epstein-Barr. Convalescent phase, which is where it goes into remission. Another recurrent cycle, and then chronic reactivation. Those are the key cycles that Epstein-Barr goes through. In the mild form of the virus, you may find fatigue, fever, lymph swelling, things like this. And it's typical to find a high IgG, VCA, or EAs, and a lack of the antibody which is called EBNA. Probably helps listening to this podcast if you actually had a copy of your blood work, your viral blood work in front of you. For those of you who don't, then just make notes on this in case you ever have to encounter this. When we have a chronic form, it's very typical that you'll have fever plus fatigue. Sometimes there's pneumonia. There are defects in the white blood cells occurring. And we find a high IgG, VCA, EA, and again, a lack of antibodies from the EBNA antibody form. In the acute stage of the virus, it's very typical, and this is more typical in mono, where you'll find the SGPT and SGOT liver enzymes elevated. You'll also find your white blood count elevated, between 10 to 20,000, very typically. Swollen liver, spleen, fatigue, fever, sore throat, swollen glands, headaches, all very common. Here it's typical to have a high VCA, IgG, IgM, and EA, but it's not unusual to have a low EBNA. When the virus changes the infected cells, it gives them, in a sense, a protection and tries to activate them. B cells will typically proliferate at this point and produce a lot of harmful antibodies which attack your own body. This is where you get these bad symptoms. Burkitt's syndrome and lymphoma all have these things in common. Antibodies will react with your body's own antigens, and this causes immune suppression, allergies, etc. You get your natural killer T cells trying to eliminate most of the infected cells. And the immune system tends to hold the virus in check or try to contain it and you'll see a drop in the immune system at some point, which then can cause, again, a reactivation of EBV. So in early or acute virus, you will see IgM VCA develop. Shortly after that, the IgM response occurs, and then you also have the EA antibody develop. The IgM then replaces the IgG in the later acute stage of the virus, and the EBNA antibody is noted in the late acute infectious stage. Both the IgG VCA and IgM VCA can be high with the EA high at the time of your testing. Unfortunately, when a person has, and this, by the way, is the reactivation stage we're referring to, when a person has the symptoms of the virus, very often there is a delay in the antibodies developing in the blood test. So at the time you're first getting your symptoms, these antibody formations may not have occurred yet in your blood test, and when you have a blood test, it may show negative. And a smart practitioner then will wait and retest you again. Probably the most aggravating situation for me as a practitioner in looking over people's histories and their tests is seeing that the person is being told they have Epstein-Barr virus, and yet they have only tested the IgG antibody, which is positive. Now, if you have a positive IgG antibody on a test, this only tells you that the person had the Epstein-Barr virus active at some time in the past. It does not tell you that there is present activation of the virus. The antibody which tells you that you have now activation, real-time, present activation, is the VCA IgM. If VCA IgM is positive at any point, at any time, it means the virus is active, and it's active right now. That's the antibody that doctors should be concerned with. A positive VCA IgG only means that the virus had been active at some time in the past. That doesn't mean it's active now. There is a loophole in this that you can look for. If you have a test from the past which shows your IgG antibody, you can compare it to your present one. And it is generally agreed upon by most people who are in the field, who are knowledgeable, that if you're showing a 4-time rise in your IgG level compared to a prior test, in order to qualify as a prior test, I would say we're talking 6 months ago or more. Could be 6 months ago, 6 years ago, definitely prior. The 4-time elevation in the VCA IgG would definitely indicate that you have an acute reactivation. So this is a very, very important. Now, a drop also, if you have a VCA IgG antibody that drops maybe by 4 times, this could indicate a remission. But typically, if you see a 4-time rise, it would indicate an acute reactivation of the virus. When we get into acute reactivations of the virus, very typical to see a drop now in your white blood count, in your T4, which is your thyroid hormone. C-reactive protein may show high at this point, showing that there's now chronic inflammation due to the virus. It's typical that you will find the VCA IgG high, and this is the one exception where the IgM may be low or normal, would be in chronic reactivation. The early warning antibody, which is the EA, would be high, and it's typical that you'd find the EBNA low. The area of chronic reactivation is the most difficult for people to deal with because the first golden rule that I laid down before is now not accurate, or not the one to look at to verify. So I'm referring to the IgM at this point. When you have chronic reactivation, you may not find the IgM high, you may find it low, but you will find the IgG quite high. But you must look at other parameters. You must look at the white blood count, because you will find the white blood count low, will be below normal. The thyroid hormone, T4, will be below normal. You could find an elevated TSH hormone. And C-reactive protein at this point is going to be high, showing now that there's chronic inflammation, which actually may express itself as rheumatoid arthritis. There are other illnesses which are associated with Epstein-Barr, like Burkitt's lymphoma. Rheumatoid arthritis is one. Various autoimmune conditions with allergies. Candida very typically elevates or starts to blossom when the person is in a chronic reactivation stage of Epstein-Barr. Sjögren's syndrome, hypoglycemia, hypoadrenia, hypo-thyroidism. These are all indications of somebody in a chronic reactivation state. The chronic reactivation state is, as I said, the most difficult for the practitioner to determine, because if he knows his data and he's looking for the high IgM, he's not going to find it. The IgM at this point will be low. He needs to then look for these other indications, like the chronically low white blood count. I think that's probably the easiest one to observe. If you have a chronic low white blood count and you have the low IgM with the high IgG, and the person has quite the symptoms of Epstein-Barr, you pretty much guaranteed the person's in a chronic reactivation state. Now, luckily, the medicines that are used naturopathically to attack Candida very often are both antifungal and antiviral, and pretty much evenly, pretty split down the middle. There are a few antifungal herbs from around the world which are definitely more exclusively antifungal than antiviral, but you'll find that quite a lot of the medicines that are made nowadays for Candida are equally antiviral and antifungal. There are modern forms of silver now being produced by companies such as the DNA company, which are probably as effective against fungus as they are viral. There's the biocidin medicine, which we've used in my practice for many years, which is, I would say, also antiviral and antifungal. It's not as effectively antiviral as it had been in the past before the formulation was changed. At one point, the formula contained an herb called bloodroot, which is very effective as an antiviral. It no longer contains that herb because the herb was just very difficult for people to handle as far as the die-off symptoms. Looking at some other antivirals that typically would be used and rotated, dioxichlor and the forms of dioxichlor, which have been made over the years, are excellent antivirals, as would be ozone extracts and food-grade hydrogen peroxide. Those three fall under the category of oxygenating products. These are very powerful antivirals. Herbs such as lomatium, very powerful antiviral, and combinations of lomatium with bloodroot, also very powerful antiviral. Olive leaf extract has shown over the years to be a very effective antiviral, as well as various herbs from China, which I won't go into, but they get a bit complicated. But China does have a very good arsenal of antiviral substances. One of the most popular herbal substances in the Americas has been echinacea. Echinacea, however, is a bit misunderstood and often misused. Echinacea as an herb stimulates the immune system, and it stimulates interferon. To use echinacea properly, you must start with low doses and each day raise your dose. You could do something as simple as take what the package recommends on the first day, and then every day double the dose. And then after five to 7 days on the product, stop it for 3 days, and then go back and restart the cycle. This would be a proper use of echinacea as an immune stimulant and as something which is going to stimulate your interferon production. Echinacea doesn't generally work very well when you just take it as directed on the label. Manufacturers tend to shy away from telling you how to use some of these products correctly. Germanium is another very misunderstood and underplayed antiviral or immune booster, let's say. Germanium should be used in much the same way as lomatium. If you're going to use germanium correctly, you could take one tablet, whatever the dosage is on the label of the bottle you have, and then each day double the dose. Do that for 7 days, then stop for 3 days, and then go back and restart the cycle again. That would be proper use of germanium, which works in a similar fashion to echinacea in that it boosts interferon in the body. The problem here with the use of some Chinese herbs, echinacea and germanium, is that their main function is to stimulate interferon. Now, there's a very sneaky thing about viruses. Cytomeglia and Epstein-Barr are the same. They tend to live in the B cells. B cells proliferate and produce antibodies. Unfortunately, the antibodies that they produce often attack your own body. Now, why this is because the virus will then live in the B cell. So the problem, and why this is always referred to as autoimmune, and why we also refer to it as opportunistic infection, is because the virus lives in your B cells, which are the very thing that are going to make the antibodies, and then they cause the immune system to attack itself. So a way to look at it would be the virus lives in a tank that you have, and the tank is a virtual important part of your immune system because this tank fires heat-seeking missiles that destroy the virus. The problem is when the virus invades the tank that you're in, and then the tank releases the missile goes out and turns around and comes right back and hits the tank, and the tank explodes. This is how the virus causes an autoimmune reaction. Because the B cells producing the antibodies which attack the virus end up having the antibodies attack the immune system itself because the virus is living in the immune cell. This is why you cannot use substances like echinacea, germanium, or anything which stimulates interferon too early in an antiviral program. These substances are best used in an antiviral program when the virus is in a remission and you're trying to reboost the immune system, let's say, or pick the immune system up again so that it's more resistive, you see, to the virus. In getting your body up and running so it can fight the virus and you have an active immune system, you have to be producing interferon, you have to be producing antibodies. You just don't want to do it at a peak at a time when the virus is alive and well in your system. Otherwise, you'll take these things and feel worse. This is one of the first things I hear from patients when they'll tell me that the doctor recommended all these immune boosting things. They're on them and they feel worse. That's a clue to me that their virus is actually active. Because if the virus wasn't active, they wouldn't feel worse from taking them. Because these things wouldn't be attacking their own immune system via the virus. So there's a hint. If you've been told you have a virus and the doctors put you on anything that resembles germanium, echinacea, or any of the Chinese herbs that are known to stimulate interferon, and if you felt worse from them, that's because it made the virus worse. All viral programs, in my opinion, must contain the substance monolaurin. Monolaurin is a fatty ester of lauric acid, sometimes called lauricidin, and this is a substance found naturally in mother's milk, which has a strong antiviral action. It's actually able to dissolve the outside envelope of a virus. It should be used in any viral program because the fact that it can destroy the outside envelope of the virus allows the body's immune system and the other antivirals that you use to be more effective. So let's say one wanted to take olive leaf extract as an antiviral. Well, you'd certainly want to combine it with monolaurin. Chymotrypsin is another important substance in fighting viruses because chymotrypsin as an enzyme also has been found to destroy the envelope of the virus, making the virus more amenable to being destroyed by your own immune system and by other antiviral substances. There are nutrients which are antiviral in their own right. Now, these nutrients may not be as powerful as some of these herbs and other naturopathic medicines, but in their own right, they can be extremely helpful in helping your body defend itself from a virus. Most likely, the most famous of the nutrients would be vitamin A, which is specifically antiviral in your mucous membranes. And then zinc. Zinc is an antiviral substance, generally speaking, but it's also highly effective as a lozenge in destroying viruses in the throat. So zinc and vitamin A, most likely the most famous of all the antiviral nutrients. There are nutrients, however, which also are viral stimulants. And these nutrients are not good to take if you have a virus because they can potentially worsen the virus. Amongst them are calcium, vitamin D, and copper. Calcium, vitamin D, and copper are probably the stronger viral stimulators. In the category of toxic metals, we know that nickel and cadmium are strong viral stimulators. So if you have nickel and cadmium in your body, you may be much more susceptible to viral activation than someone who doesn't have those. Someone who has a chronic virus in the body, if they were to do a hair mineral analysis, will typically show very high levels of calcium and magnesium, very low levels of sodium and potassium, high levels of copper, low levels of zinc, and typically low levels of selenium. They may also show elevated levels of mercury and arsenic, and again, as I said before, nickel and cadmium. Mercury and arsenic are a bit different than nickel and cadmium in terms of how they affect the virus. To my knowledge, they're not direct viral stimulators. Mercury and arsenic suppress the immune response which allow a virus. Nickel and cadmium are directly viral stimulators, and there's a bit of a difference there between those elements and how they affect the virus. So a good viral regime is going to start out with a rotation of antiviral substances, and it will have monolaurin as a base that you would take on a daily basis. And at some point when the person has achieved some type of release from the virus, you would then want to balance their elements in the body to make sure that they're not high in any of these viral activators. You want to take a look, see if the person is toxic in cadmium, in nickel, in copper, if they have very, very elevated calcium and magnesium, which is a sign of low thyroid function, low adrenal function. So the proper antiviral nutritional program has the person reducing copper, cadmium, nickel, increasing their adrenal and thyroid response, which will lower the excessive calcium that occurs when you have long-term chronic viruses. Then, once that occurs and the virus is in remission, now substances like germanium and echinacea and some of the Chinese herbs, which are immune boosting, are very helpful to rehabilitate your immune system and stop the chronic viral reactivation. Again, remember that if you use them too soon, echinacea, germanium, and some of the Chinese herbs could actually worsen the virus. Elderberry is one that I neglected to mention. Elderberry tends to be a very effective antiviral. It appears more for influenza or the rhinovirus, which is your common cold, than Epstein-Barr, to my knowledge. I don't have any experience in treating people with elderberry who have, let's say, mono or Epstein-Barr or cytomeglia. If anyone out there does, I'd certainly like to hear from them what their experience is. But elderberry is always an important antiviral to mention when we talk about any virus because it is so effective against the common influenza and the common cold. Its place against the bigger, more chronic viruses, I can't really comment on, but fair to mention it here. There are certain forms of silver which are effective antivirals, particularly by the DNA company, and also Argentine 23 appears to be more effective silver against viruses than some of the larger part per million forms of silver. Silver generally is not an effective antiviral unless you have the correct parts per million or the correct micron size. The more traditional forms of silver are effective antibiotics, as I think we've covered it in a prior podcast. Silver is going to be the medicine of the future. Silver is going to be the antibiotic, the antiviral, and perhaps just in general, the germicide of the future. I say this based on the research that I'm privy to from various companies that have been experimenting with forms of silver for years in order to make medicines which are virtually impossible for microbes to become resistive to. The company that I will drop the name on is called Results RNA. They appear to have the best line of these silver medicines to date. Well, I hope this information has been helpful. I hope you have learned things, and I hope we have, let's say, eliminated false data that you might have had, because there's an awful lot of false data out there about viruses. We've covered today proper treatment of viruses using herbal medicines, naturopathic medicines, and nutrients in the correct order. We've also covered the interpretation of blood work for viruses. And one thing I'd like to add to that is that interpreting the antibodies is not enough. I've given you today the traditional antibody interpretation for viruses, but I want to point out that I've also given you data on other parameters to look at, which can be just as telling from a clinical standpoint as the antibodies. The example I'll give is looking at liver enzymes, looking at the white blood count. A good clinical pearl for you is that in the first stage of the virus, or the initial activation stage, so we're going to call that, since we've been discussing Epstein-Barr, we're going to call that the mono stage. In the stage where you have mononucleosis, which is the first activation and the acute activation of Epstein-Barr, you're going to find a very high white blood count. It's going to be 10,000 plus. However, when you're dealing with chronic activation of Epstein-Barr, you're dealing with the person who has a low IgM and a high IgG, as I stated, elevated C-reactive protein showing inflammation in the body. You're going to find the white blood count low. So whenever you're dealing with a viral patient and you see that they have a white blood count that's low, and I'm sure someone's going to email me and ask me, what's low? Well, low would be under 3.5 from a functional standpoint. Most laboratories would agree that a white blood count that's under 5 is low. But in real life, what we've seen occur in people, in real people, is that when they have the virus chronically, their white blood count becomes 3.5 or less. It's not unusual to find a 2 or a 2.5 in those chronic cases. That's a person who has chronic reactivation. This is not someone who encountered this virus last week or even last year. You're looking at someone who might be struggling with this virus for years, 5, 10 plus years easy. And these people often do have candidiasis, and they often get strep and staph infections. They become susceptible to many other infections. We can liken having chronic Epstein-Barr to HIV in a sense. How I would liken it is that if you have chronic cytomeglia or Epstein-Barr virus or the herpes, the V6 virus, any of these chronic herpes class viruses, your immune system becomes so suppressed that you become more susceptible to the activation of other infections. Because your immune system is being held down so much, it's much easier for Candida to proliferate if given the chance. It's much easier for staph and strep infections to occur. Much easier for the person to develop any type of chronic infection. MRSA infections, Lyme infections, any of these infections this person is going to be more susceptible to. This is why when you're dealing with patients, people who have these chronic problems, it's very important that you differentiate as to whether or not they have a chronic virus, because if the person does, their treatment is going to be stalling. This is one of the first things that you could put on a qualifications list or a quality control list, that if the patient's not doing well on your plan, you want to suspect they have a virus or even Lyme disease, which is continuing to suppress their immune system. So you have a person with candidiasis or some such infection, maybe it's H. pylori or something, and they just are not getting well, even though you're giving them the correct treatment, and they swear that they're doing the treatment. The thing that could be holding them back is a chronic virus that's in the background that's suppressing their immune system. Well, again, that's the end of the broadcast today. I hope you enjoyed it. I hope we've dispelled a lot of false data. Join us this Thursday where we will have once again another podcast.
That's a wrap for this episode of the Candida Chronicles featuring Michael Biamonte, certified clinical nutritionist. Michael holds a doctorate of naturopathy and is a New York State certified clinical nutritionist. He is a professional member of the International and American Association of Clinical Nutritionists and of the American College of Nutrition, and he's a member of the Scientific Advisory Board for the Clinical Nutrition Certification Board. For more information on how Michael can help you, please visit healthtruth.com. That's health-truth.com, or phone his office at 212-587-2330.